So, good afternoon, everybody.
Good afternoon.
Thank you. That's really nice. I don't normally get that. That's great. But I especially want to thank Majority Leader Cutler, Minority Leader Dermody for being here, and of course, the Pennsylvania Insurance Commissioner, Jessica Altman. In just a few minutes, actually, I forgot also Senators Street and Scavella, who are the chairs of the Banking and Insurance Committee in the Senate. So thank you for being here. Well, thank you for being here, too. It's good to see you, too. So anyway, I want to just talk about what I'm going to do today, sign into law a bipartisan bill, and it really was a bipartisan bill. I think was passed unanimously in both the House and the Senate, that shows what we can accomplish when we all work together in this building. Every elected official, blue or red, urban, suburban, or rural, all of us have constituents who are coping with the health care affordability crisis that we all face. This is especially true for individuals who are not provided health insurance by their employers. For many individuals and families, including entrepreneurs and small business owners, the marketplace is the only option to access a doctor. House Bill 3 will alleviate some of the financial burden of health insurance for those using the marketplace. First, by creating a state-based health insurance exchange in Pennsylvania. Second, by increasing access to affordable care. And third, doing all this without putting more money into our healthcare system than we already have put into it. This year, the federal government will charge Pennsylvanians nearly $100 million in fees to cover the costs of operating healthcare.gov. Because of the advancements in technology, states can now purchase platforms to run their own equivalent of healthcare.gov for as little as $30 million. That is, we have been using the federal computer system for operating our exchange. We can now, for $30 million, basically have our own. About a dozen other states are already doing this, and they are seeing tremendous savings. As we make the transition to our own insurance marketplace, we will also begin to see those savings by collecting fees ourselves rather than transferring them to the federal government. We'll use some of that savings to pay for the cost of our own platform, but some of it will be used in combination with federal funds to create a new reinsurance program. Here's the idea of reinsurance. Right now, insurance companies set premiums based on the expected price of all the doctor visits and procedures that they expect to cover in a given year. And they include in that insurance premium the cost of outlier claims of unusual but very high dollar claims. Under our reinsurance program, the savings from the state-based exchange will cover these claims within certain parameters. By directly covering these outlier claims, premiums will decrease for all enrollees. It's not just individuals who will see savings. The federal government chips in nearly $2 billion, that's $2 billion, to provide subsidies for individual enrollees in the marketplace. If their premiums shrink, the federal government pays less in subsidies. Then, through the waiver, the federal government will put those savings into our reinsurance program. So the reinsurance program here in Pennsylvania will be funded by what we save by having our own state-based exchange and what the federal government saves by actually having this reinsurance program into place, and that they will transfer to Pennsylvania. It's pretty rare for a program to come along where we can save people money without spending more, but that's exactly what this program does. And I'm so proud of my colleagues for recognizing this as a priority and moving it along very quickly. In my administration, Pennsylvania has been a leader on health care reform, and despite divided government, we've actually been able to accomplish a number of things. It's my goal to have no Pennsylvanian worrying about affording the care they or their loved ones need. This new law represents another major milestone for Pennsylvanians. It continues the progress we've already made. More than 1 million individuals, families, and children now have better access to the health care that they need, along with more than 700,000 individuals now covered thanks to the expansion of Medicaid. The 21% increase in Pennsylvania children enrolled in the CHIP program is another thing that we've done. And the 180,000 seniors that the Attorney General and I together have worked together to protect, to make sure that they still have access in the western part of the state, especially under the Medicare Advantage program. and the more than 400,000 people buying insurance in the marketplace who are now going to have access to more affordable health care. This bill is a huge step forward toward making health insurance affordable and effective for all Pennsylvanians. And I especially, again, want to thank Majority Leader Brian Cutler for introducing this legislation and Minority Leader Frank Dermody for helping ensure that it crossed the finish line. So now let me turn this over to Jessica Altman, who is the Pennsylvania Insurance Commissioner. Jessica, thank you very much.
Good afternoon and welcome to everyone who has joined us today. Again, my name is Jessica Altman and I am privileged to serve as Insurance Commissioner for the Commonwealth. I want to begin by extending my gratitude to Governor Tom Wolf, Representative Brian Cutler, and Representative Frank Dermody for their dedicated leadership that has brought us to this significant occasion that will ultimately impact the lives of many Pennsylvanians. I also want to thank the chairs of the insurance committees at both chambers, Senator Scavello and Senator Street, and Chairwoman Pickett and Chairman DeLuca, who are represented here today as well. I'm incredibly proud to be taking a step like the one we are announcing today that will continue to make healthcare more accessible and more affordable for those that buy health insurance for themselves and their families. And that does so simply by using the dollars already going into our healthcare system better and more efficiently. Today is a reflection of significant, long-standing efforts by Governor Wolf and my department to improve healthcare access and affordability. The affordability that can be achieved through a reinsurance program like the one we're here to talk about has been recognized by our department for years. And we have undertaken research efforts to model that impact for Pennsylvania since the first waiver was approved in 2017. But we knew our waiver would have to be different than the waivers approved in other states because we were determined to provide the savings without leveraging a new tax or assessment to generate the state contribution. As we learned of the potential savings to be realized by transitioning to a state-based exchange, we saw an opportunity not only to transition Pennsylvania to a state-based exchange and provide better customer service and consumer support in that process, but also to repurpose the associated savings to generate more value to lower premiums for consumers through a reinsurance program. Before venturing too far down that path, we realized the need for this endeavor to move our healthcare system forward and to not do anything to put at risk the tremendous progress we have already made to bring our market to stability. And so we engage with all of the stakeholders core to this initiative: consumers and advocacy organizations, the health insurers who have remained dedicated to providing coverage in the individual market, the healthcare provider communities, the insurance producer community, and the business community to ensure that they supported the initiative and knew our commitment to making the transition as smooth as possible. So I'd like to thank all of the stakeholders that are here today for their tireless efforts as we have worked together to identify potential challenges, to alleviate them to the best of our abilities, and all with the collective eye of ensuring Pennsylvanians have access to more affordable health care. As one colleague recently remarked, the passage of this legislation is incredibly important, but it is a little bit analogous to registering for the marathon. The race is still before us. We have a lot of training to do and a lot of road to run before we reach the finish line. Pennsylvania's state-based exchange and reinsurance program is expected to be fully implemented for coverage that will begin on January 1st, 2021 in the open enrollment in fall of 2020. To ensure that we complete that transition seamlessly, we are working with experts across the country to build upon the extensive state-based exchange experience and actuarial modeling for reinsurance programs, to leverage lessons learned from other states, benefit from their wisdom, and learn from their setbacks. We will not delay the ability of Pennsylvanians to realize meaningful savings in their health insurance premiums. For the roughly 400,000 Pennsylvanians buying individual health insurance, this initiative will result in premiums being 5 to 10% lower than they would have been if we were to stay with the federal marketplace at healthcare.gov. This reduction in premiums will especially help those Pennsylvanians whose incomes are too high to qualify for a tax subsidy, many of whom struggle to afford their coverage today, and that's about 1 in 5 Pennsylvanians who purchase coverage on the exchange. So moving forward, I am confident that we can provide a better experience for consumers and provide much needed options and affordability to get Pennsylvanians covered. So thank you again to Governor Wolf and Representatives Cutler and Dermody and to all of you here today. It is my great privilege to introduce Representative Brian Cutler. Thank you.
Good afternoon, and thank you, Madam Commissioner. To use your marathon analogy, I would simply say, I know you're registered and you're going to set a personal record here as we strive towards that date. So a lot of folks asked what my area of interest was in this, and I thought I'd share a little bit because I think it's important because it helped to shape my approach in terms of this legislation. I want to thank the Governor, Leader Dermody, and the Commissioner, and more importantly, all of the staff in both chambers that worked on it for our behalf. Because for too long, people have been frustrated with health care. Many of you might know that I worked at the hospital prior to this as an X-ray technologist and was in radiology administration. And oftentimes when I was there, we would have questions about what care or what things were covered as opposed to what was the best approach to how to get things done in terms of preventative medicine and the approach that folks would have. And that was very frustrating because instead of focusing on making ourselves better, we oftentimes focused on what things cost. And in the current role as a legislator, we fielded quite a few questions with healthcare.gov when it first came up. And understandably, there was some concern initially. But thanks to our committees and our staff in the House and the Senate holding a series of hearings and information, it was very plain to see that the time has come for the state to take over this exchange. And we shifted to another set of questions. How best to serve the residents of the Commonwealth, those who needed access to health insurance. Nearly 400,000 individuals will have increased access and costs as outlined by the Commissioner that would be significantly below what they're currently paying, thanks to the reinsurance program, which I thought the Governor did an exceptional job of explaining, so thank you. We probably could have used you in our caucus, quite frankly. But all of those experiences and patient experiences shaped my own outlook, and it really came down to a couple simple things. What was the best course of action for the individuals who are currently on the system, and what's the best way to get access to care and while lowering costs? So thank you to the individuals in the Wolf administration for being willing to work with us in the House and the Senate and our colleagues in Washington, D.C. And thank you to the Trump administration for updating the regulations to make this even more achievable as we pursue the waivers and are able to drive those savings back into that reinsurance program. And thank you to Leader Dermody, because I know he fielded plenty of questions too in his own caucus regarding the program and the approach that we were taking. But regardless of how you feel about the status of things in Washington, D.C., we have a responsibility to govern here in Pennsylvania. And that's what this bill, I think, demonstrates more than anything else, was our ability to govern, work through a series of problems and questions so that we could arrive at a solution that it would benefit everyone. And I think that we would all agree that saving money and increasing access to health care are not partisan issues. In fact, they're issues that should be our guiding light in how we approach and solve problems like these. So while we work together on more issues, and I'm sure this is just the first of many, and as the Commissioner and the administration works through the implementation of this as we head to the fall of 2020 and the beginning of 2021 when it will be fully implemented, there may still be questions, there still may be some bumps occasionally, as sometimes happens when you work in government, but the truth is we're ready, willing, and able to continue to work together because that's what every Pennsylvanian deserves. So with that, I'll turn it over to my colleague and friend, Leader Dermody, who was a very successful co-pilot on this journey. So thank you, Frank.
Brian, thank you. You were a great partner on this, and I'm Governor and Secretary. Thank you for all your help on this. They did a tremendous job working together, and it really is an important measure that's going to help thousands of Pennsylvania consumers to have affordable access to quality health care. And it's going to save money for taxpayers and lowers people's insurance premiums. A lot of work has already been discussed, went into this effort with the Commissioner and the professional staff at the Department of Insurance. They came up with a great model that we were able to translate into smart legislation. And starting in the House Insurance Committees, both parties in the House and Senate then put politics aside and worked together in the last month to pass the bill. I want to give a special thanks to Tina Pickett and Tony DeLuca, the two chairs of the House Insurance Committee, for making sure this bill kept moving forward. Because of that effort, we're going to have a state-based health insurance exchange and reinsurance program here in Pennsylvania. And Brian is right, we could have used the governor in our caucus when I was trying to explain reinsurance. It will help us, though. It will help us keep more Pennsylvania money here in the state where it does the most good. The exchange we're setting up for Pennsylvanians and by Pennsylvanians uses what we know works while learning from Washington what mistakes to avoid so that we can all get the best bang for our buck. The reinsurance program will let insurers lower their premiums, and the best part, not $1 of state money has to be spent. This was never a Republican or a Democratic issue. It's a great example of how we can and should work together across party lines. We can make sure everyone can afford to see a doctor when they get sick. We can help our job-supporting healthcare providers. The success we've had here inspires me to think we can find bipartisan cooperation in other areas too. Finally, I want to thank Governor Tom Wolf for the leadership he has shown in getting us to see things that need to be fixed and getting us to work together to do it. You know, Governor, I guess right now all we need to make this happen and get the marathon started is your signature, and I'm looking forward to seeing that. Okay? Thank you, Governor. Thank you.
Okay, I'd be happy to take any questions on topic, by which I mean that if I can't answer them, one of these three people will actually give you the answer. Any questions? Yes?
Do you believe that this will increase participation rates for people enrolling into the exchanges? They have slid nationally.
Yeah, this in and of itself probably won't. I'll let Jessica come up here. I think it will, because it is going to reduce the cost of health insurance, and that should increase demand for the product. I think there are other things that we ought to be doing to make the act work better, but this is a really good start. Jessica, how close was I on that?
You are 100% right, of course, as always. No, it's true. Absolutely, the reinsurance program lowering premiums, the hope is that will bring more people into the market. But even more so, research has shown that the existing state-based exchanges also do a better job of enrolling people and getting people enrolled. And I think that's largely to do with keeping premiums lower, but also the investments that they can make in marketing, in outreach, in consumer support and engagement that are tailored to their states, to their markets, and to the messages that are going to resonate. And so that's one thing we can really look forward to as well.
Just to follow up,
yeah.
Does the state have a potential of how much they want to set aside for marketing, and also do you intend to increase the open enrollment back to 90 days?
Sure. So on the first question, we haven't formally set a budget for outreach and marketing, but I can say that it's something that is important to make investments in to make the marketplace vibrant and viable here. In terms of your second question, which was, I'm sorry. Sure. So state-based exchanges actually have the ability to extend the open enrollment period beyond the federal time length, and many of them choose to do so. But they actually do that by extending it partway through as a special enrollment period rather than establishing 90 days at the front. So that's an ability the exchange will have to make that decision when the time is right. And if volume is really high, if people are scrambling to get in before that deadline, absolutely the state-based exchange can make that decision. Sure.
To Republican efforts to weaken the Affordable Care Act. So, for example, an individual mandate or a ban on short-term health plans?
So I think certainly I and Governor Wolf have concerns about some of the policy changes that have happened at the federal level. There isn't legislation to do neither of those things, and a state mandate was never something we considered as a part of this initiative. But we look forward to working with our legislative colleagues on what makes sense for Pennsylvania's healthcare system beyond this as well.
Up to that, I'm curious, so to what end is a secondary goal of creating an SBE is to increase control over the individual marketplace at a time when Republicans at the federal level have been dismantling the ACA?
Yeah, I think the federal government really in both administrations that we've seen oversee healthcare.gov in the marketplace has constantly made changes to the rules. Sometimes the states like those changes and sometimes they don't. And so bringing the exchange here is going to allow the state to make the decisions that make sense for us and to provide that stability to our marketplace of knowing what those decisions are and why we're making them.
Let me just add, this is not an ideological thing, and that's why we had both Republicans and Democrats working together across the aisle on this. The goal is really to make the health care system more affordable, more accessible for more Pennsylvanians, pure and simple. Anything else? Any other questions? All right, well, thank you very much. Thank you, everybody, for being here.